Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to today's weekly news conference for the latest in COVID-19 information for the Amarillo community. We do these once again every Wednesday at 11 a.m. Let me go ahead and introduce who is on our panel today. We are joined by Amarillo Mayor Ginger Nelson, Casey Stoughton, Public Health Director for the City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Lamentier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We'll go ahead and turn it over to our panel for brief statements, and then we'll take questions from the media. We will start with Amarillo Mayor Ginger Nelson. Mayor, how are you this morning?
I'm well, Dave. Thank you. Good morning, Amarillo. Well, we're coming to you this morning with the press conference that we anticipated happening. We just didn't know when. And that is that our numbers are making a serious trend back up as far as COVID is concerned. We have had 2 days in a row where our regional hospitalization rate was over 15%. And people are asking me, well, why? Why is it that it's over 15%? What's causing that? And if it was easy to point to just one thing, then we could, as a community, work on that one thing. But really, it's several factors combined. And I think the two largest factors are that we're gathering in groups more. Schools are back, sporting events, churches are in full swing, and all of that is good. That is what we want life to be. But that is a factor because we're around each other more. The second factor is just fatigue. Aren't you tired of COVID? And aren't you tired of the changes that it requires us to make? I know I am. As a business owner, I am. As a parent, I am. As somebody who has to wear a mask to respect the health of others, I'm tired of doing those things. And I think that combination of us being back together in groups, along with our fatigue of taking the measures we need to take to do that safely, are impacting why our cases are going up. And so how should we respond as citizens? I'm asking you as a citizen, please don't respond with fear. We don't need to react out of fear. But what we do need to do is to respond with respect and with responsibility. So say yes to respecting others by wearing a mask when you're in anyone else's presence. Say yes to responsibility by making the small changes that make a big impact in keeping our community safe. And that is, what are those things? Well, I know you could tell me what they are as much as I could tell you. They are washing your hands. And that means using your sanitizer. I have to remind myself, go ahead and sanitize your hands after I've touched something out in the public. Don't get tired of doing that. Keep doing that, please. Wearing a mask. And I know this is probably our least favorite thing. Please do it. It isn't keeping the germs off of you so much as it's keeping your germs off of other people. And that makes a big difference in how the virus is spreading through our community. When you're in groups, and I know we are, and we want to be in groups, please be conscious of staying 6 feet apart. And I know it's hard. I'm around kids. I have teenagers at my house, and it's really hard to remember that this is an important part of the component, but it is. So if you are a leader, wherever you are, you're the adult in a small group, you're a teacher in the classroom, you're perhaps a supervisor or a business owner in your work, please remember that the example that you set as a leader is so important to what the people around you and under your authority are going to choose to do as far as wearing a mask and staying 6 feet apart. Your leadership in these decisions really matters right now while we're teetering on the edge here of these 15% hospitalization rates. I just want to ask and remind you, we get to decide our success in this. And if we want to stay open, and I know we want to stay open, I need for everyone in Amarillo to help us make a big impact in changing our hospitalization rate, changing how the disease is spreading through the community. You will make a big impact by doing the small things every day. And so your role, my role, is to make a big impact by not getting tired and doing the small things, washing your hands, wearing a mask, staying 6 feet apart, and staying home if you have symptoms of any kind. Those are the things that we need citizens to do, and we need to take it seriously because our economy and our health depends on it. Thank you, Dave.
Thank you, Mayor. Let's now go to Casey Stoughton, Public Health Director for City of Amarillo. Casey, how are you?
I'm well, Dave. Thank you. So just want to give you a brief update on the numbers this morning that have been reported to public health, and then talk about the Panhandle, the 25 county region hospitalization percentages. So as of yesterday, we had a total of 9,595 cases of COVID-19 reported in Potter and Randall counties. 6,260 cases in Potter County and 3,335 cases in Randall County. We have a total of 7,011 recoveries, and we're up to 123 deaths reported in Potter and Randall counties. That leaves us with 2,461 active cases. Each of the cases do represent a unique individual. The rolling 7-day positivity average for Potter and Randall County is 16%, and the positivity rate at the drive-through testing site is 28%. The public health drive-through testing site remains open, and individuals can call 378-6300 to be screened and directed to the test site. Monday, the Panhandle RAC's 25 county hospitalization percentage was at 15.49%. And last night at 4 o'clock, when the state updated the numbers, that percentage was at 15.77%. So this is the second consecutive day that our region, our 25 county region, was over the 15% threshold set by the state. At 4 p.m. each day, that number will be published. And so today we'll certainly be looking to see where we are as a group, as a 25 county group. Communications will be launching a series of PSAs with tips on how we can celebrate safely with the holidays coming. We know Halloween is next. And so we want our community to be able to celebrate safely. And so we'll have a series of tips on how we can celebrate safely as those holidays are coming. As we do continue to see cases rise and hospital capacity decrease, I'm asking all of us to consider the health and safety of others by preventing the spread of COVID-19. We need to wear a mask, stay 6 feet apart from others who don't live in your home, wash our hands, disinfect those surfaces, and stay home if you're sick or if you've been exposed to someone with COVID-19. If you AmarilloAlerts.com, there's more information there. We're constantly updating FAQs and putting additional information there. But as Mayor Nelson said, we do have the opportunity to make a difference in our curve, and we can work together to do that by preventing the spread of COVID-19.
Thank you, Casey. Let's now go to Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center. Dr. Milton, how are you today?
I'm good. How are you?
Good, thank you.
Good. And thank you for having me. Look, I wanted to talk about two words and clarify two words that in conjunction with the current pandemic today, just to see if I could clarify some confusion that seems to be out there. First of all, the first word I want to talk about is vulnerability. So let me break that down a little bit. So everyone is vulnerable to becoming infected, but we certainly realize now, 6 months into this pandemic, that there are certain risk factors that seem to cause more sickness and hospitalization and death. That includes the male sex, type 2 diabetes, an elevated BMI or obesity, chronic heart and respiratory diseases, and the elderly. Minorities seem to be especially hardest hit with this pandemic. So if we talk about numbers related to these types of risk factors in the United States, it's estimated that possibly 1/3 of the US population is obese. And if there are 330 million people in the United States, that's 100 million people. More than 10% have type 2 diabetes. And certainly the demographics in this country are that of an aging population. So we're talking about huge numbers of people that could potentially are vulnerable to becoming ill and sick and needing hospitalization and dying. And the next word I want to talk about is the potential, because I think the word potential is what we're seeing with this COVID-19 in relation to influenza. It's the potential of what this pandemic can do as opposed to influenza. We've already seen greater than 210,000 deaths thus far in this country. That is not similar to a typical flu season by any stretch. We have no vaccine, which is not similar to the flu. It is much more contagious than the flu. And we know that the numbers nationally and in our community, unfortunately, are suggesting ongoing transmission until we get a vaccine. The estimates may be that may be 18 months from start to finish. So this is similar to the 1918 influenza pandemic, which lasted about 2 years and had several different waves, but it's not the typical flu season. So once again, what can we do at this point? We can wear a mask, we avoid crowds, we practice social distancing, we stay home if we're sick, and we wash our hands. So that's all I have to say this morning, Dave, and I'll be interested to see what Dr. Weiss and Dr. Lamentier have in terms of numbers this morning. Thank you.
Thank you, Dr. Milton. Let's now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you today?
Well, David, I'm exasperated. I'm gonna echo the words of Mayor Nelson. I've had enough of viruses. I've had enough of Mother Nature's coronavirus and now the human-made virus that has impaired our computer systems at Northwest over the last week and a half. But just as we are now getting past the attack on our data systems, we are seeing COVID-19 come back with a vengeance. And then no doubt now with the deaths of Eddie Van Halen and Neil Peart of Rush, I've had enough of 2020. But in all seriousness, my fellow citizens of Amarillo, we have a big problem. We are seeing the sharpest rise in indicators of COVID activity that we've seen in Northwest Texas since the beginning of this pandemic. So let me run through the numbers and give you what we're seeing as of today. So the last couple of weeks, we were tracking at about the mid to high 20s with regard to number of COVID patients in the hospital at a given time. We were at 47 today. And that puts us at 20.7% of our acute care beds as COVID-19 related beds. Okay, so that's well above the 15%, obviously, for what we're looking at county-wide. Right now, our medical ICU is absolutely full at 20 patients. Our dedicated med-surg COVID floor is full at 25 patients. We're in the process of activating our internal surge program to try to decompress our ICU right now to allow further patients into critical care. Now, regarding ventilators, we went up by 10 ventilators as of 24 hours ago in terms of utilization. We were at 14 yesterday, we're at 24 today. And that includes 4 COVID patients that were intubated overnight. And right now, we had let a sister facility borrow some of our ventilators. We are now rapidly calling those back because we are concerned about the rise in our ventilator usage overnight. With regard to deaths, we've had 6 deaths at Northwest since the beginning of October, and that includes 3 from the same family. An elderly father, his sister, and his son all died in our ICU within the last week. We had a death of a 20-some-year-old the other day. We now have a 30-some-year-old who looks like they're not doing very well at all. So this virus does not discriminate with regard to age. Okay? So this is very concerning. Right now, our nursing leadership is really struggling to help our nurses contend with the amount of morbidity and mortality they are seeing in our ICU right now. And then a bigger problem is our staff. Okay? Friday, we had 12 staff quarantined. Okay? Since then, we have added 23 quarantine staff members, with 16 coming in the last 48 hours. Now, the problem is, even if we have beds, we're not going to have staff to man those beds, okay, if we continue to put all our staff on quarantine. And the vast majority of these exposures are due to community exposure. It's nursing staff whose family and friends are contracting this virus and coming out positive. So, and then finally, with regard to remdesivir, we've got enough to treat about 65 patients. Last week, we had 7 or 8 patients on remdesivir. We have 20 today. Okay, we have treated a total of about 165 patients. The bottom line is every indicator we see is showing us that COVID-19 is back with a vengeance and is putting a major strain in our resources at Northwest. And I've spoken with Dr. Lamentier, and I think he will tell you the same story at BSA. I am imploring people to do what we need to do to shut this down. Okay, we're all tired of this virus. We're all tired of what it takes, but we know what it takes. And Mayor Nelson and Dr. Milton have talked about this, and Casey, we've got to hunker down. We've got to do what's right, because we are going to basically extend our resources beyond capacity, and then we'll all be in a difficult situation. So that's the news I have today. Thank you.
Thank you, Dr. Weiss. Let's now go to Dr. Michael Lamentier, Chief Medical Officer for BSA. Dr. Lamentier, how are you?
I'm good, David. Thank you. Good morning, everybody. And thanks for letting me join the call today. Unfortunately, our call today does have a little bit more of a concerning tone to it, and it's for good reason. I think what you heard today from Mayor Nelson, Dr. Milton, and Dr. Weiss to this point really outlines what we're talking about in terms of a resurgence of COVID-19 in our region. We have been really hovering in the 40s, as I mentioned on our past several calls, on our press conferences over the past few weeks with our COVID census. But we hit a new record level yesterday with 69 patients confirmed in-house and admitted. We're down to 65 cases today with a few discharges. We've also had some occasional mortalities, as we've mentioned as well. And again, it tends to be a situation where folks that have comorbidities are certainly at higher risk. The advanced age are certainly at higher risk, but there are younger patients as well that are succumbing to this illness. So we have to be diligent in terms of what we're doing, and that is taking the precautions that we all know we need to take. Out of the 65 patients that we have that are currently hospitalized, we have 20 of those in the intensive care unit, and 4 of those are on the ventilator. We have absolutely been doing, I think, an outstanding job, our physicians and our nurses, with caring for individuals in a very aggressive manner, trying to keep them off the ventilator as much as possible, based on really the evidence that's coming out across the nation. When we look at our medical colleagues in the forums where folks are talking about managing COVID-19 patients with critical illness, trying to stave off mechanical ventilation is what really needs to be done, and we're doing that except when it's absolutely necessary. That's allowing us to really have only about 40% of our total ventilator capacity now being utilized. But certainly we're holding those ventilators in reserve, anticipating flu season, certainly not getting better as we move forward over the next couple months, but only getting worse because we haven't hit it yet. We're using about 48% of our high flow nasal cannula oxygen setups, which is an alternate way to provide high flow oxygen to patients and prevent them from going on the ventilator in some circumstances. And we're having some success with that. We also are using remdesivir very effectively. We're keeping stats on the percentage of patients in our facility that are COVID positive and getting remdesivir, and that tends to run about 65 to 75% of patients have had remdesivir if they're an inpatient and they've been hospitalized. The reason that's not closer to 100% is because there are some patients that have contraindications to getting the drug based on their lab profiles. Some patients are declining that therapy, which is certainly their right to do. And some patients aren't qualifying because their illness, when they initially present, is quite mild and they're able to be discharged in a short time frame. That is happening for a number of individuals, which we're always happy to see. As far as dexamethasone, in terms of the effects that we've talked about and utilizing that drug thoroughly, we've been doing so for patients with more severe illness, and we treated about 450 patients with dexamethasone that have come through BSA with COVID-19 confirmed. We also are continuing with the Regeneron trial here at BSA. We have just about 30 patients that we've enrolled so far in that trial, and we're continuing to enroll patients that are consenting to do so and that are interested in getting in that potential therapy realm versus placebo, obviously, because it is a randomized controlled trial. We're at 683 total patients that we've admitted at BSA since the onset of the pandemic. 683 over about a 6-month time frame is a large number of patients. And that number of patients has allowed us to develop an experience with managing and treating and cohorting patients in our facility and trying to understand best practices in terms of how we keep our patients safe, our staff members safe, and try to get the best, clinical outcome for those patients. And again, I think more kudos to our staff here at BSA, who's doing an outstanding job. All clinical staff, all non-clinical staff that are working day and night to do the things that we need to do to keep our patients alive with the best outcomes. I will say, just for the public's awareness, that we are continuing with restricted visitation at this time, which is not a surprise. That may trigger a more, the volume of COVID-19 patients may trigger a more restrictive visitation policy, but we have not yet made that determination. It could be in the very near future. And I think it's obvious why that would potentially be the case. We also are going to have the ability to do antigen testing here in the next couple of weeks. And we're working on algorithms right now to determine how we'd use those tests along with our PCR tests to really get quick answers for patients to allow them to be triaged up to appropriate rooms. And I want to just thank the public here in Amarillo for really being patient with us over the past couple of weeks. I've been communicating with Dr. Weiss regularly, and unfortunately, the issues they've had with their IT cyber attack can happen to any of us. And we do need to help one another when that happens. And we've had some higher volumes here at BSA as a result of that. And we've had some folks that have come to our ER and have had long waiting periods. And we apologize for that. That's not our intent, but we're trying to manage those high volumes as much as we can, as effectively as we can. And we are working on our surge plan to create some more higher level intermediate care beds to improve the capacity there, and also to continue to work on our respiratory triage area where we can keep patients that have presumed illness like COVID-19 or influenza segregated from others that are coming to the ER with different concerns in an effort to try to protect those individuals who do not have a suspicious presentation for COVID-19. So we're in a tough spot, folks. We really want to do what we can to continue to help the community, and we're going to do that. We need to stay steadfast. Please heed the advice of the medical professionals on this call and our mayor. We've got to do a good job with masking, with social distancing, and with not going to work when you're sick. That's a critical piece. Thank you very much.
Thank you, Dr. Lamentier. Now go Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well. Thank you, Dave. First of all, let me just start with our COVID numbers. Currently, we have 4 inpatients, veterans with COVID. 3 of those are in our ICU, and 1 of those is on a ventilator. We do have 53 veterans positive with COVID that are on home isolation. I note that because I believe the largest number I've ever reported here has been in the 20s. And so that's almost double what we've had in the past. Couple things I want to highlight this week. We all appreciate what our staff is doing, not just here, but at all the facilities for the COVID response. But going to shout out to a couple of areas of unsung heroes. This week happens to be National Healthcare Food Service Week and National Healthcare Supply Chain Week. And so to our nutrition and food service and logistics supply chain team for making sure that we have what we need to treat our patients, and for the making sure that all of our patients have the appropriate nutritional needs met while they're in the hospital. Just want to say thank you. The only other thing I'm going to mention is this coming Tuesday is the Navy's birthday. And so the Navy will be celebrating 245 years. And their theme this year is Victory at Sea, which is really to highlight their efforts in the battles during World War II in the Pacific. Of note, I think the team was really wanting to get after me, knowing that I'm very big with the Army and always saying, go Army, beat Navy. But wanted to remind me that we 6 of the presidents since World War II were Navy veterans. And so what I want to do is give a shout out to all of our Panhandle Navy veterans and just say fair winds and following seas. Thank you.
Thank you, Dr. Gonzalez. Let's now go to City Manager, Jared Miller. Jared, how are you today?
So I'm doing great. That's a great lead in from Dr. Gonzalez, handing off to a Navy veteran. So thank you for the shout out to the Navy. Go Navy. Want to remind everyone that the drive-through testing center remains open. If you feel sick and you have symptoms you think might be COVID, call Public Health Hotline at 378-6300. You'll be screened for the drive-through testing center. Talking about the drive-through testing center, we want to make sure that everyone understands that Amarillo City Transit, if you're referred to the drive-through testing center, is available to provide free transportation to that test and back. If you are referred for testing, call Amarillo City Transit at 378-3095 to arrange for that free transportation. We want to make sure that every person in Amarillo has access and a means to get to the test and to be able to get that free test. We've all mentioned, everyone's mentioned the masks. It is part of the governor's executive order GA-29. Every person shall wear a face covering over the nose and mouth when inside a commercial entity or other building or space open to the public, or when in an outdoor space wherever it's not feasible to maintain 6 feet of social distancing from another person not in the same household. There are some exceptions, but I do want to say that I know in talking to my friends that certain people in the community, they take it as a badge of courage to just not wear their mask. And we all have different opinions on whether or not we like masks. I don't think anybody likes a mask. Nobody likes to put on a mask, but we do have a responsibility. We do have a obligation to the people that we are with to take care of them. If not from a safety standpoint, from an economic standpoint, because if we go 4 or 5 more days at above 15%, we will move into the classification per the governor's executive order GA-30, which I'll go into in just a second, of an area of high hospitalization. So we all have a role to play, if not from a public safety standpoint, from an economic standpoint. It's important to our recovery. It's important to our ongoing recovery. So GA-30 it superseded GA-28, and it allowed the following areas to operate at 75% occupancy as long as we are not an area of high hospitalization. So we're moving toward that potentially. Those areas that can currently operate at 75%, or those establishments that can operate at 75% include retail stores, restaurants, office buildings, manufacturers, museums and libraries, and finally gym and exercise facilities. So it's very important that we take the masking seriously. We take all steps that can reduce the spread, reduce the transmission very seriously. Washing hands, social distancing, wearing the face coverings, all those things. So that's all I have, Dave.
Thank you, Jared. This time we'll now take questions from our media members. We have a question from an individual member of the panel or the panel as a whole. That's completely fine. Let's go ahead and start with News Channel 10. I'm gonna take a guess here. Either Kevin Welch or Vanya Patino. Do I have that right on one of them?
You're stuck with Kevin.
Well, Kevin, that's perfectly fine. I had a 50% chance of getting it right. So how are you this morning?
Good. How are you?
Good, good.
Say, I guess the first thing is, in the week that's passed since the last time we did this, have we seen any more impact from the Neil unit cases on our statistics or the hospitals?
I can answer that partly. This morning, there were 3 patients admitted at Northwest from the Neil unit, and 1 I think was on the ventilator. So it's about the same.
Okay. And as far as getting test results from the drive-through, we continue to get communications from people who are saying that it's taken a week or more than a week. Does that sound right? I know the goal is not that, but.
No, and patients every time someone comes through the drive-through, they're given instructions on how they can log into the patient portal and to be able to access their test results as soon as they're available. And so there's multiple ways that people can access their test results. They can logging into that patient portal, and then our staff call them as soon as we have the test results.
Okay, they're reporting no phone calls and being told that the tests aren't available when they go online. And this has gone on for, with somebody that I know, 8 days so far.
Okay, well, I'm certainly happy to look into it, but I know that those are the processes in place. And so we can certainly look into especially specific cases.
Yeah, I was just wondering if there was a log jam or not, but you don't think so? Okay.
I don't think so. We've had pretty consistent lab results. We haven't had any backups, and so I'm certainly happy to work through specific cases with individuals.
Sure. Okay. And speaking of the city, how are you coping with the sharp increase in active cases of, now over 2,400 compared to where you were at 2 weeks ago?
Sure. So most of those active cases are from the NEAL unit. And so the NEAL unit would handle those inmates or those offenders who would be in the prison system. And so we're working through that backlog. It's certainly putting a strain on our staff. And so, we need everyone to practice those prevention efforts. Stay home if you're sick. If you know you've been exposed to someone with COVID-19, that 14-day quarantine would apply. So we all have to do our part, and our staff are working through the case investigations and the contact investigations as quickly as possible.
Okay. And as far as Northwest and BSA, have you all had to tighten your criteria for admittance or sent patients to other facilities?
So I say Northwest, we're using the same criteria. We have had to divert some patients from our facility due to capacity, and also certainly with some of the IT struggles we've had. So, but in that sense, is patients who need to be admitted will be admitted under the same criteria we've been using.
And at BSA, we have had a couple days this past week where we were close to hitting that threshold of considering whether we had to divert some volume, but we have not. And we have stabilized slightly since the past day or two, where we were hitting that threshold nearly. And really the issue has become staffing. So our nurse staffing situation is such that we're looking for outside contract nursing and additional help because of very high total volumes in the hospital, up over 300 consistently. And again, as I mentioned, 65 of those now being COVID patients. And I just want to add to that from that prior question, none of the admissions for COVID at BSA are secondary to the NEAL unit.
Okay, thank you. Last one, I'm not sure who could handle this, but we're also hearing from viewers about Halloween. Is there going to be any kind of, Casey, I think you were talking about there's going to be something online about holidays. Where can we refer them to for recommendations for safety?
So we'll have those the CDC's guidance on Halloween on AmarilloAlerts.com, and then our Celebrate Safely Halloween PSAs and tips will be on social media, on Amarillo Alerts, and then on the different news channels where they'll have PSAs available.
Okay, thank you. That's it. Thank you.
And Casey, when will those materials be available, just to clarify for them?
So we can have the CDC guidance up by the end of today, as well as some of the social media posts. I think those will be coming up just shortly. I can check with communications on the schedule of that, but those will be coming up certainly by the end of the week. And then they have been the PSAs, the videos have, I think they'll be sending out to the different news stations by the end of the week as well.
That's correct. All right. Hey, thanks, Kevin. We appreciate it.
Thank you.
Let's now go to, if I'm not mistaken, Morgan Durden of KVI Channel 7. Morgan, how are you today?
Hello, I'm good. How are you?
I'm good, thanks.
All right, my first question is for Dr. Weiss. You spoke about the limited hospital beds and the staffing issues you've had due to people quarantining. What are some of the options that a Northwest has, responding to ER calls, new COVID cases? How do you handle these situations when you have these patients coming in? And are you diverting patients to BSA to help out with that?
Well, options are somewhat limited. I mean, I guess first you appeal to your staff to take on extra shifts, things like that, to help with this. Certainly, as Dr. Lamentier mentioned, we've had to rely on some outside nursing resources through the Regional Advisory Council. The RAC has helped us with this. We greatly appreciate ESA's help, especially over the last week and a half when we were really struggling with trying to get back on our electronic medical record and get our IT systems back up. But the answer is yes, we've had intermittently to have to go on to some form of diversion just because of some of the reduced efficiency with the IT systems. But it's a big concern because it does come a point where there's only so many staff and they can only work so many hours before they become completely exhausted. And that is the fear of this whole situation, is making sure that we do not hit that point at either hospital.
Thank you. My next question is for Dr. Lamentier. With the increase of cases and patients coming in, is there concern of separating COVID-19 positive patients with other patients in the hospital?
That's a great question, and we have our surge planning, which really has looked at that type of scenario where if we have a significantly increased COVID population, how do we keep them cohorted? And we've been able to do so even with this high volume of patients, and that is that we have a specific intensive care unit and a specific unit on our med-surg floor that are our primary COVID units. We've had to expand beyond those into newer ICU beds and newer, and I say newer meaning new to COVID-19 patients, med-surg beds to be able to handle that volume. In doing so, we're still able to cohort patients and keep as much as possible non-COVID patients out of the same unit, nursing staff segregated so that we're minimizing exposure to those patients. And it's really been quite effective to this point. On our med-surg floors, we have been prepared to and have our facilities ready to have some rooms be potentially doubled up if we have a higher census, which is something that we were approaching this week, but at this point have not had to have any kind of significant doubling up in the med-surg beds.
Thank you. And my last question is for Dr. Gonzalez.
And when I say that,
sorry,
just to be clear, I'm sorry, I want to just clarify, the rooms would be doubled up, obviously. We have rooms that are large enough to handle 2 patient beds, and thereby, if we had to double up with those negative air pressure rooms, and again, it's not our desire, but we'll do that if push comes to shove.
Thank you for the clarification. Dr. Gonzalez, my next question is for you. I spoke with Mr. Robert Wilkie this morning, and he was kind of talking about VA centers returning to, quote, normal. And with the surge and things like that, are you guys reaching out for normal wellness visits, and are you guys still staying restricted for what's your plans?
So we have increased our number of available face-to-face appointments. We are offering about 75% of the available appointments or offered appointments that we had about a year ago now. So we are increasing. We actually just went to 75% this week. So we have increased those and we'll continue to offer. Now we do watch, and I really don't want to take that step back, but if we need to, we will.
Thank you. That was all the questions I had.
Thank you, Morgan. We'll now go to Aaron Langston of KAMR Channel 4. Aaron, how are you today?
Pretty good. How are you?
Good, thank you.
First question is, with this recent spike, it appears that we are at the same number of active cases as we were back in May when we were under tighter restrictions and, well, everything was more or less very minimally open. Are we looking at potentially revisiting a situation like that?
Well, as far as the restrictions go, those are a function of the governor's executive orders. There is some flexibility to have different standards in areas that are high hospitalization. And I kind of alluded to it, but to be very clear, if we go 7 consecutive days at over 15% hospitalization rate, the retail stores, restaurants, office buildings, manufacturers, museums, gyms, and exercise facilities will all revert from 75% allowed occupancy to 50%. That is the only consequence of being a high hospitalization area per the governor's orders as they currently stand. It is very possible that if we experience these type of situations statewide, or if there's a uniquely high situation in any one of the trauma service areas, which we are a 25 county trauma service area, that the governor might produce subsequent orders that would provide different standards either for the state or for those unique areas. But at this point, with our current caseload, we are required to stick with the governor's executive order GA 30 and GA 31.
Okay. And has there been any discussion of going back to the level red?
We have discussed it, and we continue to work on that. It's a challenge to be, we want to make sure that whatever message we put out with the color that we're using is consistent with our situation. So as we're in GA 29 and there's a lot of things allowed, we want to make sure that we keep the color consistent. So we're discussing that internally also with our regional partners, because we're more than just the city of Amarillo with regard to our health district. We're also part of Randall County and the city of Canyon.
Mandatory mask ordinance. Is there any discussion at this point in having a mandatory mask ordinance?
No, there's not. In fact, I believe that the governor's order that requires that cities don't have the ability to put in a mandatory mask order beyond what he's done with GA 29, which is a requirement for people to wear masks. So there is already, through state executive order put out by the governor, a requirement for people to wear masks in specific situations, and it does include exceptions as well. Those exceptions are, there's quite a few of them. They don't represent many people. So when you're out and about in a store or not social distancing outside, you are required to wear a mask. Now, I think what you're talking about would be wearing a mask all the time, anytime you're outside, and we don't have anything like that.
Alrighty. And going back to the occupancy numbers at BSA, Dr. Wise talked about how full the COVID unit was and the ICU. How is BSA faring percentage-wise on those?
Our ICU volume is very high. We continue to have a near capacity situation day in and day out. There's a lot of ebb and flow in and out of the ICU where we're trying to appropriately triage patients to an intermediate step down unit or to the general med surge beds. And that's a coordination that happens with our nursing supervisors and administration and our physicians attempting to determine who needs those critical care beds the most, if you will. So again, that has led us to look at augmenting the size of our intermediate care unit, and we're going to be expanding some of those beds immediately so we can have some more capacity for step down. Today, we have a little bit more reprieve in terms of our ICU volume, where we've created some additional capacity, but this is a day in and day out fluctuation. And as we all know from the COVID population, patients can go from looking pretty good and having fairly modest oxygen requirements to suddenly being severely hypoxic and needing to be transferred to the ICU. So there's that type of mindset that at any time we could have an increased taxation on our ICU beds.
Alrighty, thank you. And next question: do we have any schools in the area that have high enough case numbers to where there's a possibility of going back to the at-home learning? And do we have quarantine numbers for those schools?
Currently not. On the dashboard, we have the number of cases represented at each school along with the number of recoveries. And then we don't have the number of quarantines listed at each school, but we can certainly work with you on if there's a specific school that you're interested in.
Alrighty, I think that'll work. Thank you very much.
Thanks, Aaron. Let's now go to David Gay of Amarillo Globe News. David, how are you today?
I'm all right. Hope you guys are doing well. I guess I just have a clarification for Casey, because the area is in the midst of of 2 days being above 15% hospitalization rate. If that does continue, will the dashboard on Amarillo Alerts be updated over the weekend to show those new percentages during this time?
No, the dashboard is only updated on Monday through Friday, but we will certainly, we can work with our communications team on how we can get that information out.
So if you want to access the new hospitalization rate numbers over the weekend when they're updated, go to the Texas Department of State Health Services.
Yes, it's on there. They have a dashboard at the Department of State Health Services. You can click on it's a red button called Case Counts, and it's on their hospitalization dashboard.
And you said 4 o'clock on every day.
Yes.
Okay. I think that's the only clarification I need. Everybody else asked all the questions I had. So have a good week, everybody.
You too. Thank you, David. Those are all the questions we had from the media at this time. I want to thank all of our panel members for taking the time out today to provide this information to the community. Once again, we do this every Wednesday at 11 a.m. This is David Henry. I'm the Communications Manager for the City of Amarillo. Thank you everyone for attending, and we'll see you next week. Thank you.
Thank you.
Thank you.